Hi, I'm Elliot Chu. I'm the Interim Dean for the College of Science.
I'm JP Jones, and I'm the Don Bennett Moon Dean of the College of Social and Behavioral Sciences.
The two colleges are really excited to bring this lecture series to you. This lecture series is centered on the COVID-19 pandemic, both the past, present, and future of where this pandemic is leaving us.
The two colleges are really excited to bring you fresh perspectives that emerge from combining the insights of both social science and scientific scholars. This pandemic has wreaked havoc on global health, economies, exposed systematic inequalities, disrupted family and personal relationships, and frankly, disrupted our understanding of time and place.
This pandemic is going to have an enormous impact on every aspect of our daily lives. So we've decided to create three conversations. The first conversation will be between a geneticist and a historian, and they're going to discuss the pathways that pandemics have taken throughout history and how this one is impacting our lives. The second lecture will be between a compassion expert and an audiologist, and they're going to be talking about both empathy and compassion and how that can help us get through this amazingly difficult time. And the third conversation will be between a biologist and a communications expert who are going to talk about how human perception and behavior can help fight this pandemic.
And this program will be hosted and moderated by Nancy Montoya, an award-winning journalist and reporter with the UA Marketing and Communications team. Nancy's worked with PBS, CNN, NBC, AZPM, and she's an SBS graduate of the School of Journalism. Thank you, Nancy, for doing this for us. And thank also Mike and Beth Kasser and Holula Companies for their financial support.
Thank you, JP. We're really excited that both of our colleges can partner to bring you this conversation. I hope it's informative and also very much helpful during this very challenging time.
Welcome, everyone, to the third in a three-part series about living with the COVID-19 virus. We have some guests today. Joyce?
Good morning. My name is Joyce Schroeder. I am professor and head of molecular and cellular biology at the University of Arizona. I have a research lab where we study metastatic breast cancer and try to understand what causes it to metastasize, as well as develop therapeutic interventions for breast cancer. In addition, I'm helping to lead the reentry for the University of Arizona to come back face-to-face.
Great. How about Rain?
Hello, everyone. Good morning. My name is Rain Liu. I am an assistant professor at the Department of Communication. I just came to the UA 1 year ago. My research is focusing on persuasion and social influence, especially developing messages, trying to promote health and environmental conservation related research. Right now, I'm collaborating with other colleagues on different COVID-19 related projects, including a big cross-national research targeting participants from the United States, Italy, and China, trying to see if we have or different factors influence people's preventative behaviors. I was also working with a university reentry nudge group, trying to help develop strategies for the university to reopen the campus. Yeah, we actually just received a grant from the university to maybe start a campaign or social norm related campaign to also help promote the preventative behaviors when students come back to campus.
That is important. I know that. We've been, the previous conversations we've had, we talked about the history of pandemics and what happens afterwards. We also talked about being in the moment now, what's happening right now. What I'd like to address with the two of you is, what about after, if there is an after of this pandemic? What do you think our world will look like?
Well, I think just like any other viral disease that sweeps through the world, we're going to have to grow to live with this virus as we do with other viruses. And over time, we will realize what has to be done so that we can go about and live our lives and go back out into the world and interact with each other. Obviously, now we know that we need to be wearing masks so that we can mitigate the disease. There's a lot of great research out there that shows us how important mask wearing is for coronavirus. And whether or not we'll be doing that on long into the future is we just have to see what happens with other mitigations, such as development of vaccines or therapies or other possible routes to control the infection. But I believe that we will get back to a sense of a normal life, just like we do with other infectious diseases.
And yet, Rain, while research has shown us that wearing masks is indeed one of the things that is one of the largest preventative measures, it appears that many are not heeding the word. What is the problem with the messaging? That's what you do. You handle, how do we message to people so that they understand the importance? What's going on?
Right, it's a very good question. I believe lots of experts like Joyce and other people might have the same issue with that as well. So from my understanding, especially let's talk about in the US, right? Because different country really deliver different messages to the citizens that also created different reactions or preventative behaviors later on. But from as far as I am concerned, the issue is messaging for masks really about how the messages are complicated against each other. As if we still remember at the very beginning of the disease, maybe back in February, March, we were told specifically by CDC experts or by all the news that do not wear a mask. It's not necessary to wear a mask. I believe everybody still remember that time. And so we also have bias, we have different opinions about wearing a mask. Some people believe it make you look like a sick person, or you may generate some panic around people who saw you wearing a mask, right? So that was a first problem. Later on, of course, as more research have been conducted and also more empirical evidence shown up, and then we start to realize, oh, it was not the right suggestion, right? So we start to hear different messages about, no, you should wear a mask. And it is going to be one of the most effective way to help reduce the cases, things like that. And then with the general population, then people will start to wonder, oh, which one shall I believe, right? Especially if all the messages were from source with credibility. That's what we talk about, experts or researchers, people like that. And people were in a very complicated or very dilemma kind of situation to really choose which one to believe. I believe that definitely generate or brought about some of the issues we're facing today.
And Joyce, when we talk about messaging on this, we've had very little direct communication from the highest levels of the federal government. In fact, the messages have been mixed left and right. What would you have preferred to see? What would have helped more to stem this virus?
Well, definitely messaging from the top is important. But one of the things that I think not a lot of people appreciate is the novelty of this virus led us to not understand everything that we needed to do right away. There was a lot that needed to be learned about this. The scientific community really jumped in and very quickly learned a lot about this virus, learned a lot about its transmission, but catching up the general public with all that information has had a longer lapse than it should have been. So for example, when the information first came out saying don't wear masks, this was based on previous information about things like seasonal flu and colds and things like that, where we know that because of the way that those viruses work, masks don't do a great job with those. And so it was assumed that masks also wouldn't do a great job with coronavirus. But once the scientists actually did the studies and evaluated, we discovered that masks do a great job against coronavirus. And so then they needed to get that new information out there. And it's just, in the interim time, it sort of turned into this strange political discussion instead of a health and scientific discussion. Whereas we know now masks are a great thing, great for containment of this virus, but somehow the messaging has gotten stuck. And, as a scientist, we always wonder, what is the best way to get the actual data out to the public? And unfortunately, I think we fail a lot of times, but it would certainly help if our leaders would explain the science to the general public and let them understand, it's a process. This learning is a process. And we thought one thing, we did some more experiments, and now we learned what the reality is, and now we know what the right thing is to do.
You said something that was interesting. You said that the scientific community jumped on it right away. To a layperson, it feels like it's taken forever to figure out what this is, how to deal with it, what's different about this and other coronaviruses. Explain a little bit about why it takes so long to figure out some of the solutions. I think many people who are listening to this may not understand that this is rapid.
It's incredibly rapid. I think one of the things we don't appreciate is about how fast we've learned about what this virus does is because we grew up with things like the flu and we think, oh, everybody knows what it is, everybody knows how it's transmitted, but what we don't realize is it took decades to gain all that information. And for us to be able to do things like sequence it, find out where it came from, do all the tests to find out how it's transmitted. All that information took many decades. The development of a vaccine, many decades. And what we've done instead with coronavirus is we've turned around in less than a year, actually probably 6 months. We knew so much about this virus. We knew where it came from. We knew how it jumped into the human population. We learned how it works. We started targeting it with therapies. That is breakneck speed for finding out something about a biological entity about which we knew very little a year ago.
Anything to add to that, Rain? I know that you're into messaging, but you're a scientist as well. What do we know about how quickly the messaging started and then it shifted and now we're trying to rectify ourselves again?
Mm-hmm. I actually first want to say Joyce brought about a very good point regarding why we're receiving mixed messages. Of course, we saw some negative or unexpected consequences out of that, but definitely we have to acknowledge there were different factors which lead to this result, right? But we're, especially as a scientific community jump in, we're trying our best to help correct the public perceptions. That's actually one thing communication experts have been doing. We're researching for decades, trying to really correct the misperceptions which has been unfortunately established among the public, how we can actually help with that. So in what Joyce brought about is a perfect point that maybe from a science communication or a health communication perspective, how can we actually maybe use the power of opinion leaders? That could be formal opinion leaders like our president or community leaders, our mayors, governors, people like that, or informal opinion leaders like social media influencers, where people like that, how we can maybe take or use their influential power, trying to inform the public about what's really going on, why we're receiving different messages, which one shall we really follow right now, so that the public will, because we do have our credible or perceived credible sources, right? So if we can use maybe the power of opinion leaders, that will help to be more effective when we're trying to correct the misperceptions or just biased perceptions among the public.
One of the more recent facts and figures that we have come across is that that age group, the 20 to 40-year-old, Joyce, they are not heeding the word as much. What do we know now about those 20 to 40-year-olds? Where are they in the spectrum of becoming infected or passing on the virus?
So as far as becoming infected and passing on the virus, there doesn't seem to be any demographic that's more easily infected. The only difference being under 20, they seem to be very difficult to become infected and to pass the virus on. But over 20, we all seem to be infectable at similar rates. The difference is what's going to happen once you are infected. So the death rate is extremely high, over 65, and it really appears to be an immune function story. So the better your immune system is, the stronger you are, the less comorbidities you have, the better chance you have of surviving coronavirus. But even though that's great if you're in your 20s, that doesn't mean you can't pass coronavirus on to anybody else that you're around. And so trying to fight, you know, the social norms of a 20-year-old to tell them to stay inside is very difficult. There's also a lot of psychology about being in that age bracket and needing to be around your peers. So it's a very tough line to walk with that age bracket. But if they can understand the message that wearing a mask, and they can still do some things together, they just need to be wearing a mask and be more careful while they're doing it, they can really help contain the spread.
How do you share that message, Rain? How does that message get through to those 20-year-olds who absolutely are part of our population at the University of Arizona? We are dealing with them all the time, that 18 to 24-year-old range. How do you reach them?
Yeah,
That's a tough one, huh?
very tough question. And I believe all the university administrators, everybody's working in this group where that's our target population to work with, right? To begin with. I want to quickly share one. I saw a news, I believe that was yesterday or so. Some 20 years old were trying to organize a coronavirus party. They're literally trying to reward whoever got tested positive as a first person in that group, and that person will get a prize or something.
Wow.
That was really shocking for me to really saw that news. Of course, we already know all kinds of not rational or not sensible behaviors from that group. In general, I'm not targeting each individual, but in general from news. But that one still came just very recently, as with everything going on. That was still very shocking, right? So one thing, especially from my research background, as I just mentioned, still maybe we have to really think them as a group. Okay, so social norm really work or function within different referent groups. Referent groups refer to whoever you believe are the most important people in your life.
Right.
You care what they think about you, like their opinions. We call that social approval or social perceptions. We also care what's the prevalent behaviors in that groups. So basically, if my reference groups, my perception about them is everybody's doing the coronavirus party, everybody's still going out, everybody's not wearing masks, and you're very likely to follow that, perceive the prevalence of the behaviors with that group, right? Or if you think, oh, if I wear a mask and then people will think I'm not cool, I'm just a coward, things like that. Yeah, and that would also reduce their intention to wear a mask or doing any preventative behaviors as suggested. So from just the angle I'm talking about, maybe targeting those groups will be, rather than just individuals, will be a more effective way. And then we should also, as mentioned above, I just mentioned, like targeting the opinion leaders within those groups. It can be any opinion leaders in Greek life or in any groups within college, where
athletics
even,
or
yeah, exactly, people like that, or anybody who's a superstar in that specific residential hall. We can target those people to send the messages to them and trying to get their help with delivering the messages and also shape the norm in a certain group. I believe that, and the research showing that has been more effective than targeting each individual.
Right. So the messenger is just as important as the message itself. Joyce, let's go over to you. One of the things that seems to be something that attracts many of the younger, that 20 to 40-year-old age range, is the use of technology. You've been working on a method of tracking those who have the COVID-19 virus. Can you tell us a little bit about that and what you hope it will lead to?
Sure. And the first thing I'd like to do is say we're not tracking people. I'm gonna change your verbiage there. So what we're working on is a exposure notification app. So it's an app that you download onto your phone, and then the phones with low energy Bluetooth we'll send out these random streams of numbers. Just every 3 to 5 minutes, we'll start sending them out. And any phone that also has the app downloaded will hear those random strings of numbers. And that's it. So everyone, well, how does that possibly help us with coronavirus? So the app works by constantly sending out this information and communicating with phones nearby who are listening for that information. And that's really doesn't do anything until a person who tests positive, who also has the app, will put into the app that they've tested positive, and then suddenly those string of numbers that have been going out will have a little tag on them that says, the person who owns the phone, who's sending out this random string of numbers, has tested positive. You have come in some proximity to this person for a length of time that would indicate that you were exposed to coronavirus. So now you should go get tested. And that's all it does. It doesn't, go ahead.
What's the name of the app?
COVID Watch.
Okay.
And it's not collecting any information at all. It doesn't even collect location information. So it will never know who you are or where you were or even who you were talking to. That phones are really just talking to each other, either in the presence of a signal that says, yes, this person has contacted SARS-CoV-2, or in the absence of that signal. And that's all that's really happening. And in this way, we can notify people of their potential exposures in a really scaled up way. So instead of a traditional way where a contact tracer would call somebody up on the phone and let them know that they've been exposed to an infection, instead, the phone can just send it out to everybody that person has been around for the last 14 days.
Joyce, thank you for sharing that app. I think it has been a very interesting, and also the app with the potential to help with the situation on top of just really messaging, sending the messaging. We're nudging people to, take actions for preventative actions. So I have a question quickly that how did you have, of course, it's important, people will be questioning about the privacy issues where, will my data be stored and then be analyzed? Will I be traced? Will I be known for, my daily life routine, things like that? Yeah, even though you mentioned the app is definitely not designed to collect those personal information and definitely is not tracing anybody's daily routine or life, right? Does the app, do you already install or trying to send out some messages about that to educate the users or potential users about that? Of course, we know we have sort of a agreement whenever you download the app, which is fine rates and nobody's really going to read it. So do you have maybe some better ideas where you already design some other better message like channels to deliver those information?
Yeah, absolutely. There's a lot of misunderstandings about what this app is actually doing, which is completely reasonable because of the entire history of different sorts of apps and different programs on your phone. And we all know that things have tracked us. And every time we get an advertisement for something that we happen to be talking about 2 weeks before, and we think, oh no, now we're actually installing this thing purposefully. A huge amount of work has been put into the API of this app. So basically, Google and Apple work together, which in itself is a monumental thing because, they're usually, their chief competitors are each other. But because of the importance of trying to contain the spread of this virus, they decided to work together and create an API that collects zero data at all. And they've done a really good job of controlling all the different aspects that everyone's really worried about. And then different app developers, the app developer that we're using is COVID Watch, is then coming on top of that and using that to help us out. But most people don't appreciate all that background work that's gone into it to ensure our privacy and our anonymity. And so in addition to rolling out the app and making sure it works well, we also have to do a communications campaign. So alongside with the app development, we're also putting together an education campaign by which we explain to everybody exactly what it is, exactly what it does, point them towards all the information they want. This app is actually open source. So anybody who has that level of knowledge and wants to really dig in there and see what it does, they can dig in there and see what it does. And then we have to do a sort of marketing campaign, just like we were describing, for explaining how great masks are at containing this virus, we have to do a similar marketing campaign to help them understand that we need as many people as possible to utilize this app, because if just a single person did it, it wouldn't do any good, right? Because it needs to talk to another phone to let them know if they're close by or not. And the more people we have, then the better it'll work, because that will help us sort of put a net across our community and identify those people who have come into contact with somebody who's tested positive. We know historically that the best way to contain an outbreak is to find the people who have it and to isolate them away from the rest of the community, but not just those people, but also all the people that they've been in contact with, because especially with coronavirus, people who don't have symptoms can have the disease and be spreading the disease. So we need to know who is in contact with who so that we can isolate them away from the rest of the community, which allows the rest of us to go about our normal lives.
Mm-hmm. Yeah, I think that sounds a great idea, especially the education campaign perspective. I think if we're trying to promote the app, especially to a general population, not just maybe college students, maybe people with less or lower level education in our entire community, if we want to include them into this trying using the app, we definitely need some work in terms of how to deliver the messages to them. And also it may be a good idea to we call that like separate the target audience. So maybe this target audience, this way, this channel, this source of information would work better when we design the message targeting them. But when we maybe targeting let's say for example elder community members who may be more conservative or have more concerns or have less level of understanding towards how, for example, what is API or what is those technology, we can trying to simplify those terms. We're using simplified message or video or graphs, infographics, things like that to target them. So if we can maybe separate those different target audience and then do different types of messages, that would work also more effective than just one general message and trying to shoot that to everybody.
Yeah, I completely agree with that. We have our marketing and communications group on campus who are really trying to parse out those really important ideas that you just talked about, the difference between educating a 20-year-old and educating the 70-year-old professor who's going to be in the same room with them, that
Right.
we need to target our education to them very specifically. And it's a very different message. They want to hear different pieces of the puzzle explained to them.
Yeah, that's definitely something I totally agree with, and I like the idea. And also one thing, it just came to me, also the source of information. So you just mentioned the app also has definitely input from the big tech companies, right? So I found some research showing that people have less trust on those companies. Maybe we can also, in combination, of course, they're the developer, we have to have their name there, but maybe we can also include experts like you, or experts from computer science, or professors, people like that, to endorse or to help explain how the app is working, so that people will have less concern regarding the privacy issues, the data problems. From my own research showing people trust university professors more than like government officials or companies, for-profit companies. So that's just another thought came to me.
No, it's very important. In fact, when we were trying to decide which app developer to go with, we chose COVID Watch because they are actually a nonprofit that was created by privacy experts from Stanford and Waterloo universities, where that's all that they do. And it's incredibly important to them that privacies and anonymity and anything that you can do along those lines is maintained as much as possible. And so it was really important to us that we chose a group that also had those same standards that we had regarding those issues.
So Joyce, so far we talked a lot about how we are going to maybe implement the app majorly on campus, especially targeting students. What's your thought regarding we're going to promote this app in our communities, including maybe faculty members, staff members, and also, of course, students, family members, and the general population in the community.
Yeah, for the app to work optimally, everybody would be using it. And we think about our university as a community, but it's really a community within a community. We're integrated into our city and county and state. And so the more widespread something like this is, the better it is. Google and Apple have decided that they're going to allow use of this technology on a state-by-state basis. And part of that is that the only group that can issue whether or not a person has a positive test is the state departments of health. And that's to keep just anybody from putting in a positive test, because you can imagine that if anybody could put in a positive test anytime they wanted, you could actually use this app maliciously, right? If you wanted to take a whole group of people and get them to go home, you'd walk amongst them and then put in a positive test, right? So we don't want anything like that happening. So we need to have it regulated. And the regulatory bodies are going to be the state departments of health. And so the hope is that eventually the state departments of health will utilize these state by state. So there's already a few states in the nation who are trying to do statewide apps. They're not like this, and we're hoping that eventually they'll get into this direction. But right now, the state of Arizona has approved us to use this particular app developer because it's because of all the reasons that we've already discussed, and they're really it's a great developer, and it's really important that they maintain privacy, and they have a great group of scientists and privacy experts who are backing them. And so the state felt that it was a good bet, and the state is backing it with the hope that eventually, once we pilot it, work out any issues that have to be worked out on a small level, that we can actually take it across the state. So one of the things that we're already doing is we're piloting it here at the University of Arizona, but Northern Arizona University in Flagstaff also is going to be doing a pilot in August, and then ASU also wants to have it on its campus as well. So we're going to start with having the 3 universities having it on our campuses, and that includes students, staff, and faculty will all be able to utilize this. And then hopefully the state will expand it throughout the entire state so that all of our communities will be integrated, which is the best way to contain the virus.
Is there anything that you can tell us about the cost of this app? Is there a cost involved for the user? Is there a cost involved developing this? Where are the costs?
So there's definitely a cost involved developing it, but how that cost will be transmitted to the user still hasn't been evaluated. At this point in time, the app developer estimates they've put in almost $6 million into volunteer time, because there's about 400 volunteers around the world who are doing everything they can to get this app up and running as quickly as possible for this nonprofit. But to continue to have it running, it has to be monetized. And so there will be a cost to the University of Arizona for piloting it and running it out. At this point, the plan is that the University of Arizona will bear all that cost so that all of the student, faculty, and staff can have access to that. And that will be just part of being a part of this community. But once it goes up to the state level, there hasn't been any decisions made on how that is going to be paid for.
The final question to both of you is that we have a long road to go with this COVID-19 virus. What are the things we should be doing today in our present to ensure that our future is going to be better, is going to be livable? It may not ever look the way it looked before, but what are the things we need to be doing today as individuals or as a scientist? What should we be doing now?
It's definitely, I would say, a long way to go in terms of really back to our normal, like the normal before everything happened. And of course, we have no idea if we would ever go back to normal, right? Lots of people are talking about for our life to really go back to normal, the only cure is the vaccination. We have to have the vaccination for us to be able to really sort of conquer or defeat this virus, at least temporarily. So I think that's definitely something Joyce might going to share more input. She's an expert in that area. From a social scientist perspective, I would say we just have to really embrace the new norm, the new normals we're going to see in our daily life, that can become part of our routine. You know, we never have any routine. It's all a process of establishment, right? So if we actually start to think in that way gradually, we're going to move to a new normal. Again, from a social norm perspective, the more you see people are doing that thing, the less strange feeling you would feel about a certain behavior. You would feel, oh, that's just something people normally would do. That's how we have the word social norm, right? So if we start to see more and more people wearing a mask in the public places, where if we see people are, when you come back home, the first thing is not hug each other, but take off some coats, outside coats, take off your shoes, maybe quickly wash your hands, and then going to hug each other, kiss each other. I think that's something we're expecting to see, and also we hope people can engage in, at least in the near future, to help us really reduce the cases for now. Also, from my personal background, I am from China, and I literally observed the whole process when everything, like nothing happened in the US. The other side of the world, my family members, my friends, they started all the crazy episodes like us. We always joke about, they have moved in when they started season 1, we haven't started shoot the drama, right? And then now they're in season 10, we're almost a finale, we're just maybe season 2 or so. We're always joking about that. But even looking at what happened back in China, my family, my country, my friends, just normal people, individuals, I think their life are pretty much back to normal. They're doing whatever they were doing before, of course, with lots of more precautions. And also whenever just one single case came up, one single case, it will be reported to the public, and everybody knows, oh, in this province, there's one case fund. There's in Beijing city, there's 3 cases fund. I think the government, the public start to embrace the idea that we have to really take every case seriously before it expanded to the larger population, because we have learned a hard lesson from what happened back in Wuhan a long time ago. So that's kind of my scientist and also personal hat, between different scenarios.
How about you, Joyce? What do we need to be doing now so that our future might be a bit brighter?
Well, I do think we will return to life very similar to what it has been in the past. This is not the first deadly virus that has come across humanity's doorstep. And eventually we will equilibrate to it. That's going to be through us behaving the way that we need to for containment, testing, isolating, developing a vaccine, developing therapies. All these things are within our reach, but we need to do them. And that's probably the biggest lesson that I hope we all learn as a society from this pandemic is we have known for decades that there would be a virus jumping. What do I mean by known? It's simple biology, it's simple evolution. This is what viruses do. They're out there in the world, they jump from species to species. It was, statistically speaking, only a matter of time until one jumped into us that we couldn't fight off. So this isn't a surprise to anybody who studies infectious disease. The real problem is our complete lack of preparedness in this country. So there's a lot of countries around the world that were prepared for just such an event. They had PPE stockpiled, they had the ability to rapidly get up to testing, rapidly trace infected people, isolate them. And you can see in those countries, they responded fast, they responded well. And as Rain was just pointing out, their lives are pretty much back to normal. Whereas in this country, and as well as others, there were other countries who didn't do a great job like us. What we did instead is we pretended it wasn't going to happen. For some strange reason, we ignored all of the experts who said, this is going to happen, you need to be prepared. And we didn't, and we weren't. And so now we're in this terrible situation where we had to lock down our society pretty much. And now when we try to go back out again, we can't go back out again because we're still not listening. And what we need is for our society to realize that this is a part of life on this planet. Species jump, people get infected. There's ways to deal with it, but putting our head in the sand isn't the way to deal with it. So we can get prepared. We need to deal with this one, mitigate, wear our masks. Eventually a vaccine will be developed, but vaccines are not fast and they're not easy. I think 2 to 5 years is a reasonable expectation for a vaccine. In the meantime, wear our masks, mitigate the spread, and then be prepared for the next one so that the next time something comes around, we don't have this terrible situation and we can respond.
Well, thank you both. And both of you offered a little bit of hope for the future. I'm very grateful for that. You know, when you're stuck in the middle of something like this, you tend to be in the moment and you're thinking about all the things that you do not have right now that you used to have. So Joyce, you're saying hang on a little bit longer and follow the rules. And Rain, you're saying follow the rules, basically, is that
we embrace the new norm.
Embrace the new norm. I love that.
Right.
Well, I want to thank both of you, Joyce Schroeder, Dr. Joyce Schroeder from the College of Science, and Dr. Rain Wuyu Liu. Did I pronounce that right?
Yes, that's
All
absolutely
right.
correct. Thank you.
From the College of Social and Behavioral Sciences. Thank you very much for joining us, and please go out and have a good day.
Thank you.
Thank you.